Mental disorders can range from the common to the downright weird. In this video, we will explore 5 of the world's rarest and weirdest mental disorders, from persons who are convinced that they are dead to those who have lost control of their own arm. Let's get started. Number 5, a journey of self-awareness, exploring apotemnophilia. Apotemnophilia is a psychological disorder where a person has an acute desire to amputate one of their limbs, usually an arm or a leg. This disorder is more common than assumed and affects people of all ages, genders, and backgrounds. It is considered a type of body dysmorphic disorder, which involves an obsession with a perceived defect in one's physical features. Those who suffer from apotemnophilia report feeling that the limb in question does not belong to them, and many experience phantom limb sensations. In fact, some people go so far as to describe the limb in question as a foreign body that needs to be removed in order to feel whole again. With this disorder, the sufferer is often unable to explain why they feel this way, but many attribute it to a feeling of imbalance, disconnection, or not belonging. The condition is typically associated with a severe emotional impact, with distress and confusion being common. Some sufferers may become so frustrated that they will ultimately resort to self-mutilation in an attempt to remove the limb from their body. This is obviously an extremely dangerous measure, and one that should be avoided at all costs. Therefore, it is essential to be aware of the signs and symptoms of apotemnophilia in order to ensure that help can be provided when needed. Treatment for apotemnophilia involves a combination of psychotherapy, medication, and support. In some cases, patients may be referred to physical therapy to help with the phantom limb sensation. Ultimately, the aim of treatment is to help the sufferer understand their feelings and to find alternative ways to cope with the distress they experience. Number 4, Alice in Wonderland Syndrome, a journey of perception. Alice in Wonderland Syndrome, AWS, is a rare neurological disorder characterized by displacement of one's spatial, temporal, and body image perceptions. It is also known as Todd's syndrome, after the doctor who first diagnosed it in 1955. People with AWS often experience distortions of their perception of size, which can cause them to believe that objects are larger or smaller than they actually are. For instance, they might think that a chair is a giant or that a table is tiny. It is a type of perceptual distortion, similar to the feeling of being in a dream. Other symptoms associated with AWS are distortions of body image and space. The sufferer will experience difficulty in regulating their body posture or in knowing where they are in relation to other objects. They might also feel that their limbs or body parts have grown or shrunk, or that their limbs are out of place. They may have difficulty keeping balance and have trouble estimating distances between objects. AWS can also cause temporal distortions, leading to a distortion of time perception. Sufferers might feel that time is passing very quickly or slowly, or that events that have occurred in the past are happening in the present. Although AWS is uncommon, it can be a distressing and disruptive condition. It is associated with a range of psychiatric and neurological disorders, such as migraine, epilepsy, autism, brain tumors, and head injuries. Treatments for AWS include psychotherapy and medications such as antidepressants, antipsychotics, and anticonvulsants. Number 3, imposters in our midst, Capgras delusion. Capgras delusion is an extremely rare disorder that affects the way a person perceives those they are close to. The sufferer believes that someone they know, such as a family member or friend, is actually an imposter and has replaced the original person. Capgras delusion is believed to be caused by a malfunction in the section of the brain responsible for facial recognition. This can lead to a range of strange behaviors and symptoms, such as an inability to recognize familiar faces, paranoia, and even physical violence towards the perceived imposter. For example, a person with Capgras delusion might be convinced that their brother has been replaced by an identical imposter. They may be fearful and suspicious of this imposter, and may go to great lengths to figure out who they think is the real person. They may even become aggressive towards the imposter in order to test their authenticity. In some cases, the person with Capgras delusion may suffer from a sense of loss for the original person that has been replaced. In order to diagnose Capgras delusion, doctors must first rule out other possible causes, such as a medical condition or substance abuse. Treatment for the disorder typically consists of psychotherapy, medications, or a combination of both. Cognitive behavioral therapy can help patients to make sense of their distorted thoughts and gain an understanding of why they are perceiving the person in their life as an imposter. Medication is sometimes used to help reduce symptoms. Number 2, alien hand syndrome. Alien hand syndrome, AHS, is a rare neurological disorder where a person's hand appears to behave as if it has its own mind or personality. It is also sometimes referred to as Dr. Strangelove syndrome, named after the Stanley Kubrick film because in the movie, a character's hands seem to have a mind of their own.
Principles of leadership and tradition.
Typically, the affected hand performs a variety of strange and random activities, such as grabbing, picking up, opening and closing, reaching, and even writing. One of the most famous cases of AHS involved a woman whose left hand kept snatching food from her plate, even though her conscious mind was telling her to stop it. Her hand was completely out of her control, and it seemed to have a will of its own. In another case, a patient's dominant right hand would write unintelligible words or draw bizarre shapes without the patient's conscious effort or intention. In both cases, the hands were observed to be acting independently of the patient's conscious intentions. The exact cause of AHS is unknown, but it is believed to be related to damage in the brain caused by a stroke, trauma, or a tumor. It is also thought that it is somehow connected to the disconnection between the brain's hemispheres, since the affected hand usually appears to be the one opposite the hemisphere that is damaged. In general, treatments for AHS involve cognitive and behavioral therapies that teach the affected person how to control and manage their movements. Medications may also be prescribed to help reduce the severity of the symptoms, but there is no cure for AHS. Number 1, A Corpse Among Us, the reality of Cotard syndrome. Cotard syndrome, or walking corpse syndrome, is a rare and debilitating psychiatric disorder in which sufferers hold a false belief that they are dead, or that some part of their body is missing or rotting away. This bizarre and intense disorder affects fewer than 1 in a million people and is often linked to severe depression and other psychological issues. The syndrome was first described by French neurologist Jules Cotard in the late 19th century and is believed to originate from a combination of genetic, environmental, and psychological factors. For those suffering from Cotard syndrome, the disorder can be highly distressing and can profoundly affect daily functioning. In some cases, individuals may refuse to eat or care for their bodies because they think they are already dead and thus don't need such activities. Many individuals may also exhibit symptoms of apathy and disconnection from social networks and their own life. One particularly severe case of Cotard syndrome was reported in 2003 and involved a 38-year-old woman who believed she had no blood in her body. The woman had a long-standing history of mental health issues, and it was believed that her symptoms had been triggered by a family tragedy. She displayed an array of symptoms, including a belief that she was dead and reduced self-care behaviors. Overall, Cotard syndrome is an incredibly rare disorder, yet can be incredibly devastating for those affected. It is often linked to depression and other psychological issues, and can cause severe distress for the individual. Treatment can include psychotherapy, medications, and hospitalization in extreme cases. Recovery is possible, though it is dependent upon the individual, the severity of their symptoms, and the management of their triggers.